This morning, live healthy as we mark Breast Cancer Awareness Month. We want to help our viewers better understand their options during their yearly mammogram screenings. Radiologist Dr. Dianne Johnson with HCA Florida Memorial Hospital is joining us via Zoom this morning. Good morning, doctor. Thanks for being with us.
Good morning. It's a pleasure to be with you this morning.
Would you explain, please, what are the options for mammograms?
Well, right now, we mainly have two options that are widely available. There are some more advanced options, but the two that are most widely available are conventional 2D mammograms, and now we have 3D mammograms. And you'll also hear that called tomosynthesis. That's just another word for a 3D mammogram. And more, these 3D mammograms are widely available. In fact, all the breast centers in Jacksonville, including the Memorial Breast Center and many of the freestanding breast centers, also have 3D mammograms available.
So let's talk about the difference of these as they apply to someone, to a woman who might have dense breast tissue. Would you first explain why it's important for a woman to know whether or not they have that?
It's really important to know your density. And when we talk about density, we're talking about how much breast tissue is on your mammogram. It varies. There's 4 categories, A, B, C, and D. A is the most fatty, and D is the most dense, and obviously B and C are somewhere in between. The more dense your breast tissue, the more chances, well, first of all, you have a slightly increased risk of breast cancer the more dense your tissue is. But importantly, breast cancers can hide in that dense tissue on your mammogram. So cancers show up white on a mammogram, and breast tissue shows up white on a mammogram. And so basically what happens is, if you think about it, it's almost like if you have a white carnation in the middle of a vase full of daisies. It's really hard to see that carnation because it's surrounded by all that dense tissue.
Is that why it's important then to make sure that if you do have dense breast tissue that you get a 3D mammogram as opposed to a standard 2D?
I do recommend a 3D mammogram. Actually, I recommend a 3D mammogram for anyone that can get it. So if your insurance covers it, and most of them do now, but you can check with your individual provider. If it's available to you where you go to get your mammogram, I recommend a 3D mammogram for a couple of reasons. First of all, it's been shown to increase breast cancer detection. So that's a good thing. So when we do the mammogram, our goal is to detect breast cancers as early as possible when they're the most treatable. The earlier we catch them, the more likely they're going to be completely cured. The other thing is with the 3D mammogram is that it does give us a way to see through some of that dense tissue. But I will tell you that dense tissue is a problem even in the 3D mammogram. It's just one of the limitations of mammography in general. So there are a couple of options available to women with dense breasts. And when you go to get your mammogram, you can actually talk to the center where you get your mammogram and see if some of those are available. For example, there is a test called a fast MRI, which is an MRI exam that uses the same technology like if you have a shoulder or knee MRI, but it uses some special equipment. It's very quick. It's about 10 minutes. And you can do another test. This doesn't replace mammography, but it's another test that can help see through some of that dense tissue. And so that is available in some areas. We have that available here at Memorial, and there may be some other centers in town. I'm not sure, but certainly your provider can help you with that. There are a couple of other options as well, including whole breast ultrasound, which is not widely available, but is available in some places. But the point is that you have to know what your density is. And so the next question is always, well, how do I know what my density is? And in Florida, if you have dense breasts, you will be notified in that results letter that you get when you have your mammogram. You can also ask when you get your mammogram if they can tell you what your density is while you're there. Most places should be able to do that for you.
Dr. Dianne Johnson, great information this morning. Thank you so much for your time. We appreciate it.
Thank you. Always good to be with you.